So this is just to mention to you that the blood supply to the pons is via the basilar artery. Okay? Basilar artery. And this basilar artery is made up of three branches. The most medial is known as your paramedian branch, supplying the medial part of your pons. You have the short circumference, the lateral portion, and the long circumferential supplies the posterior part of your pons. Okay? Pero isa lang pinanggalingan ng basilar. Okay. Then lastly, we have the midbrain. Now the midbrain, you have the three parts of your midbrain. Huh? You get a cross section, the superior colliculus as I mentioned, and the inferior colliculus. If you cut the midbrain and the superior colliculus, for you, ang tatamaan mo is your oculomotor nucleus. Pag hinat mo yung midbrain at the level of your inferior colliculus, ang makikita mo is your trochlea. Okay? So these are the different parts of your midbrain. This is the crus cerebri na tinatawag natin, which is the ventral portion. You have the substantia nigra, and then you have the tectum, tegmentum, and then you have the tectum. So these are the three components. Okay? Tapos tayo.
Nice one, Papi.
I cannot start early dahil ako may clinics. Medyo na matagal ako magbakasyon din kaya napakan tayo. I'm supposed to start at 4 o'clock, so we started late. But anyway, this is your midbrain. This is the three parts of your midbrain. The cerebral peduncle, which is made up of your crus cerebri and your substantia nigra. You have the tegmentum, and over there is your tectum. If you cut it at the level of your inferior colliculus, your tectum, you see the trochlear. If you cut it at the level of the superior colliculus, you have there your oculomotor nucleus. Now, what I want you to remember here is that in the crus cerebri, hinati natin into three parts. Lateral 1/5, medial 1/5, medial 1/5, and you have your medial 3/5. Okay? The medial, the lateral and the medial 1/5, okay, 1/5, 1/5 is made up of your corticopontine fibers. Okay? While the medial 3/5 of your crus cerebri contains your corticobulbar and corticospinal fibers. Okay, so yun lang tatandaan ninyo, na the corticobulbar and the corticospinal fibers descend in the medial 3/5 of your crus cerebri. Okay, while your medial 1/5 and lateral 1/5 contains your corticopontine fibers. They will go to the pontine nuclei. Okay, so this one, what's one? Now, the substantia nigra, yung kulay just posterior to your crus cerebri, is made up of two parts. Dorsal, zona compacta, and your ventral reticulata. Okay? Now, this pigmented mass, the zona compacta contains the melanin pigment that contains your dopamine. Okay? And this is the one that is usually compromised in patients with Parkinson's disease. Okay? While the ventral zona reticulata contains iron compounds. Okay? So it is the dorsal component of your substantia nigra that is usually affected in patients with Parkinson's disease. The neurotransmitters in pigmented neurons, which is the zona compacta, is dopamine. The non-pigmented neurons is either cholinergic or GABAergic. Only pigmented dopaminergic neurons are those in the center of the substantia nigra are lost in patients with Parkinson's disease. Okay? So pag sinabi mong Parkinson's disease, you're referring to the neurotransmitter dopamine, lacking of your dopamine in the pars compacta of the substantia nigra. Okay? Superior colliculus, tectum, pretectal area, pigmentum, and central peripheral gray. The tectum is a laminated. I've mentioned this already. Okay? Pretectal area, which is just dorsal or superior at the rostral of your superior colliculus. In the midbrain, these are important stations for reflex pathway for pupillary light reflex. Okay? So remember, pupillary light reflex, pretectal area of your midbrain. Abducent, trochlear nucleus. The only cranial nerve that exists dorsally to supply your superior oblique muscles of your eye. Now, this is pag kinuha nyo cross-section ng midbrain and you see the circular area known as the red nucleus. Pag nakita nyo yung red nucleus, if you look at the slides, pag nakita nyo na itong red nucleus, you're sure that you're at the level of the superior colliculus. Okay? And when you say superior colliculus, what cranial nerve, what cranial nucleus do you see? Oculomotor. So at the periaqueductal area, you have there your oculomotor nucleus. Okay? So there's a red nucleus, here is your oculomotor nucleus, and then it goes out, passing the red nucleus known as your oculomotor nerve fibers, and then they exit via at your interpeduncular fossa to go inside the superior orbital fissure. Okay? So this is now your crus cerebri, substantia nigra. Ito makikita niyo talaga sa slide, ha? Dark one is fiber, white nucleus. Okay? Crus cerebri, substantia nigra. This is in the cerebral peduncle. Tegmentum, you see that the red nucleus. Okay? You can see this is three fibers known as your oculomotor nerve. Pag nakakita kayo ng mga ganitong palabas, at the level of the superior colliculus, that is your oculomotor nerve. Madalas tinuturo yan. You identify this nerve, oculomotor nerve. The red nucleus, this is your periaqueductal gray. That is your anong cavity at the level of the superior colliculus? Connecting the fourth and the third superior aqueduct. Okay, so cerebral aqueduct. And inside the periaqueductal gray, also have there your Edinger-Westphal nucleus, which is the nucleus for the pupillary constriction. Okay? Okay. Rostral, meaning to say, when you say rostral part of your midbrain, you are looking at the superior colliculus. Okay? Characterized by the superior colliculus, which is for visual reflex. You see that the red nucleus, you see the oculomotor nucleus. Okay? Periaqueductal gray, yung kulay puti around the iter. Oculomotor nuclear complex. Oculomotor nerve. Supplies your extraocular muscle except superior oblique, which is supplied by what? Trochlear. And lateral rectus, which is supplied by abducens. Okay? It also supplies the superior palpebral muscle, okay, for elevation of your upper lid. Okay, kaya you'll be able to move your upper lid upward because of your oculomotor nerve. That's why if you have a problem in the oculomotor nerve, anong una mo makikita? patient will complain of diplopia, double vision, kasi hindi siya makakita immediately. Okay? And you also see drooping of the eyelid known as ptosis. So pag may ptosis, double vision, oculomotor nerve. Okay? Edinger-Westphal is the preganglionic parasympathetic neuron for pupillary constriction. Goes out, it goes out via the ciliary ganglion to supply the ciliary muscles and your sphincter muscles. Forget about this. Okay? Now, dito sa midbrain, basta nakita niyo ito, crus cerebri, red substantia nigra, pero walang bilog. Notice the difference? You don't have the red nucleus, you're at the level of your inferior colliculus. So you have here at the periaqueductal gray, you have there your trochlear nucleus. Okay? Caudal midbrain, inferior colliculus, trochlear, the decussation of your superior cerebellar peduncle. So itong pinapakita dito. If they ask you to identify this, in the superior colliculus you have the red nucleus, di ba? But what you see in the inferior colliculus is the decussation of your cerebellar peduncle. Okay? Yung mga sinasabi ko sa inyo, lahat, those are the things that they ask in the practical exam. So at the superior colliculus, pag bilog, red nucleus. Pag the inferior colliculus, madali naman ma-identify ang midbrain. Okay? Pag nakita nyo na kagad yung crus cerebri, substantia nigra, midbrain. Pero walang bilog, inferior colliculus. So this one must be the decussation of the superior cerebellum. Otherwise, if it is you have the rounder, you have the red nucleus at the level of the superior colliculus. Okay? Blood supply to the mesencephalon midbrain coming from the basilar artery via the paramedian as well as the superior cerebellar and posterior cerebral artery. Pons, anong blood supply? Basilar. Midbrain, basilar, as well as superior cerebellar, hindi superior cerebral. Kung minsan, sinabi nilalagay niya superior cerebral. No. It has to be superior cerebellar and posterior cerebral. Okay? Forget about those syndromes. You mentioned that already. Sabi ko nga bawat slide 1 second talaga. Alam na natin kung anong mangyari if you have lesion of your oculomotor nerve. Don't forget those. Blood supply, basilar, superior cerebellar, posterior cerebral. Thank you.